What it is, what it is.
Welcome back to Dog Talk.
We're back at it.
Feels good, man.
Feels fantastic, man.
We got the crew back.
We got the crew back. We got our homeboys back. We got our new studio. We got a new logo. It's finally time for us to start
Cover
posting
some medical topics too.
We haven't done a lot of medical topics in a while.
And
so
people
I'm
have been
pretty
asking,
excited.
so we kind of got to get to it.
They have.
What's our topic today?
Something that you suffer from. And you called me about it a lot. So our topic today is erectile dysfunction.
Yes.
Yes. So go ahead. No, go. You're the expert.
No.
So
Listen, hang on. For any guy out there that's having this issue, watching it with your wife, don't watch it with your wife. She's gonna make fun of you the whole episode, and then she's gonna act like she's a doctor too.
Is that what happened to you?
No, that's not what I'm saying. AJ, why you keep saying that? Did my wife? Did she tell
you
you
called
something?
me last week? You had an issue.
I did not have an issue.
Well, look, you avoided eye
I asked you for Viagra, but that was it.
No, I got Cialis.
The thing is I feel like people get confused about erectile dysfunction, what it is, different causes, how to treat it. All they know is my thing can't get up. Give me a medication.
Yeah.
They don't know that there's other ways to do it. And tell me about erectile dysfunction.
Well, I think you know what the biggest problem is, MJ. To be honest with you, the hardest part of erectile dysfunction is actually admitting it to your doctor.
Yeah.
That is the hardest.
But that's why
part.
I feel like a lot of guys are like, "Oh, I'm happy you're a guy. It's easier for me to talk to you about it."
Yeah, and it is. And initially, once you open that topic up with your primary care doctor, then you can talk about treatment options.
Yeah.
But the first thing is there's really no test. It's all about your symptoms. It's how do you complain and what it is, and can you actually have an erection, right? Erectile dysfunction, they also call it impotence too. So it breaks
it's a little
down.
advanced for them, you know?
Yeah, but
I love you guys, but just saying.
But erectile dysfunction is also called impotence if you look at it. But there's really two typical kinds of erectile dysfunction.
Okay.
Is it a physiological problem, like a medical issue, or is it a psychological problem?
That's why
stress, anxiety, depression.
That's why you have to ask the patient, do you have morning erections?
Yeah.
Morning wood, right? That's the first question I always ask, because if you get morning wood, but then the second you're about to have sex, it just doesn't function, it's psychological.
Yeah, obvious.
Right? Like that kind of it goes together.
Yeah, obvious.
And
or if you have like some people with their significant other, for example, like if you have a thought process and you get an erection. Some people watch stuff on the internet. Some people watch TV and they get an erection.
Yeah.
Then most likely psychological, and you need to talk to your spouse and maybe talk to a psychiatrist to see, or a sex therapist, right? Because there's a lot of sex therapists as well, that you can figure out a way to improve your sexual performance in the bedroom,
exactly,
at home,
and
whatever.
The most important part that people need to understand is that in order to get an erection, you need blood supply to your penis.
Absolutely.
Right? And in order for the blood supply to get there, you have to be relaxed.
Yes.
Which we talked about, the parasympathetic, sympathetic, right?
Exactly.
The parasympathetic is the relax. Sympathetic is, the fight or flight, right? Yeah. That thing, right? Well, so if you're relaxed, your blood pressure goes down. Your arteries dilate, and you get an erection. So when you're relaxed, but if you're tense, your girlfriend, your wife is putting so much pressure on you. You better perform today. You're thinking about it. Your blood pressure is high. Your arteries are constricted. It's not going to get up.
You're not going to get up.
You need that blood supply to get the erection.
Absolutely.
So don't put pressure.
That's that parasympathetic state, right?
Yeah.
The actual erection happens in that parasympathetic, that relaxed state. Now, of course, the ejaculation process, right? After you.
That's why it's point.
Yep.
And shoot.
Shoot. And that's how you get that sympathetic response.
Yeah.
So I think that we need to talk about treatment options when it comes to this situation.
Or some causes. You were just telling me about it. Tell them about it.
Okay,
so we talked about the psychological. Tell me about the physiological.
The physiological, let's talk about smoking, obesity, diabetes.
It's always those people.
Yeah, of course. Anything that affects the blood supply to the actual organ, to the penis, is going to cause a problem. Atherosclerosis is a big one also, right?
So explain why atherosclerosis. So like, what is it doing that's affecting, right? Atherosclerosis, it's a blockage.
Yeah, it's a blockage.
So you're not getting the full blood supply to the penis, so you're not getting the erection.
Exactly. It has to do with a lot of like CGMP, nitric oxide. There's a lot of physiological aspects to it, of course. But I don't want to go into too much detail with that because it's going to confuse
them. 100%.
Very simple, okay? If you're a smoker, you're obese, you don't exercise, most likely you're going to have erectile dysfunction.
Stop buying the damn pills from the gas station.
Yeah, I know.
It's always that guy that smokes cigarettes, buys Dunkin' Donuts.
350 pounds. Is like,
I'm like, bro, how's your sex drive? Phenomenal. I had 3 hours of sex. What'd you do? No, I drank some coffee, smoked some cigarettes, bought 3 pills from the gas station.
Exactly.
Boom.
Cool.
You're going to die in a couple years, bro. That's not how it works.
Exactly.
Like, you're going to harm yourself.
So
you know in those movies where the president dies?
Yeah.
He always takes a Viagra before.
Yeah, or he takes an extra pill because he thinks it's going to help him more.
Boom. Blood pressure drops. They end up dying.
Exactly. And that's the scary part. I think initially we need to approach that, right? If you're smoking, quit smoking.
Yep.
If you're overweight or obese, lose weight, right? Exercise. They say the majority of erectile dysfunction patients are between the ages of 40 to 70. Typically, that's where it really starts.
100%.
Right? But I see it in a lot of younger patients as well, in their 30s.
And more and more now.
Because of the psychological issues,
all the Red
because of our
Bulls,
stress, because of our diets. So yes, absolutely. So you got the physiological aspect, and of course you got the psychological aspect. And that's something that you need to sit down and talk to your doctor about, you know?
Exercise. I always say, like, let's be honest. The second we started exercising, when I started like feeling good, my sex drive improved drastically.
Absolutely.
Like drastically.
Absolutely.
They say like 40% improves. Okay, I just made that up on the spot right now. My own case study, okay?
case study, folks.
The MJ case study is after I worked out, I lasted longer. I was having better. I mean, it's not comfortable for everybody watching, but exercise really, I feel like it's the biggest thing.
Yeah,
it really improves it the most. And when you exercise and you can't breathe, you quit smoking.
Yeah.
You stop eating bad, right? And then your sex drive. Every man wants to have a good sex drive. If you care that much about your sex drive, stop smoking.
Yeah.
Stop eating bad.
Increase your activity.
Yeah,
you know
get moving a little bit. How is your thing supposed to move if you don't move? You know,
Good, man. you want to see.
You don't want to be the guy on the bottom the whole time, right?
Exactly.
Like you got to start getting a little bit creative here, bro. All right, we're getting a little bit too much. This is not proper.
But
proper.
Let's get back. Let's get back to the treatment options, right?
Yes.
So of course you have the the Viagra, the Cialis, right? Okay, whichever one you decide. There's a lot of different brands. The other option is if you want to speak to your urologist or your primary care doctor is a penis pump. You know, and
that's like
but see, that mechanism of a penis pump is just basically to just increase blood flow to.
All I think about is like
penis.
somebody putting a pump and it's like.
Well, that's kind of what it is. It's just
I've had some really bad complications with patients though, man, and that pain.
Oh no, it's painful.
God.
It's painful.
I would not want to go through
the
that.
other option is a penile implant, and that's something I would probably never ever consider in my life. It's pretty painful, but it can help you hold your erection. So
I mean, if you're at that age and you really just want to get it done, I mean, you gotta do what you gotta do. Women get breast implants. Yeah. Men are allowed to get penis implants. It's just a little bit more painful, you know.
I wouldn't do it personally.
No.
But you know what? I got you. I'll send you to my buddy. You know, and he'll take care of you.
Yeah.
He'll give
for
you a
me to
discount.
donate to somebody.
No.
Okay.
We're not donating. We're just
because I had extra.
We're using you as a dummy. We're using you as a dummy.
Makes sense.
Yeah, if that's okay with you.
That's absolutely okay.
Perfect. So a quick.
We talked about Viagra.
Yeah.
We talked about Cialis, and Cialis also helps with enlarged prostate.
Yes, it
so
does.
People that have prostate issues always have erectile dysfunction too. A lot of the time, Cialis can help that. You have Levitra, but again, guys, we're not recommending that you take any of this stuff. We're just saying that these are the medical things that doctors can prescribe to help you out. But before jumping to that, just like with everything else, like a diabetic, before jumping to medication, change your lifestyle.
Of course.
And it's easier said than done, but I promise you, you start exercising, quit smoking and lose weight, your wife will never leave you. I promise. Yeah, so just get on that level. That way you feel safe and you don't have to, you know.
And that's why there's a lot of people who get a lot of medications off the streets, right? Or, oh, you know what? I took a Viagra or a Cialis or a Levitra from one of my friends. You got to be extremely careful because there's a lot of side effects of these medications. And there's a lot of medications that are contraindicated to take with
especially blood pressure medications.
But that's what it
because
is,
it
right?
brings your blood pressure down.
A lot of these nitrites, exactly. And patients end up in shock.
100%. And if I always say, like, before you take a pill, check your blood pressure.
Yeah, absolutely.
If your blood pressure is 80 over 50, do not take that pill.
Yep.
Because you might end up, that might be your last time having sex.
Absolutely.
I mean, it better be worth it.
Absolutely.
You know?
And another thing also is what my patients tell me personally is I had a lot of patients that would take it after meals. Like a Cialis or a Viagra, which it doesn't help that much. No. But for some reason, they say that it helps on an empty stomach or maybe 2 or 3 hours after food. So then you have an empty stomach and then you could go ahead and try it. It'll work a lot better. But
planning, right? But that's one thing that they complain about too. They're like, okay, I'm like, take it 1 hour before sex. Like, what do you mean? If I'm in the moment, my wife's kissing my neck, you want me to say, hang on 1 second. Let me get my notebook. I got you in at 5:30. 1 hour before, we'll take the Viagra. So if you don't want to get to that point, just get healthy.
Yeah.
Get healthy and, you know, talk to your primary care about this. Figure out if there's a root cause to it. Get yourself healthy before you jump into the medication side.
For sure.
I think that's a great first topic to get back into it.
I think that's fantastic. I think people are going to like this. And I think a lot of my uncles who are older are probably
they're all watching
this and enjoy it.
I guarantee you one of them is pointing to his wife. I told you it wasn't me.
Yeah. Well,
and honestly, I want to say one thing before we leave. The psychological aspect is huge.
Yeah,
people don't understand how much, like, and if you're somebody, like if you're a wife and you're putting a lot of pressure on your husband, like you better perform, and it's mentally in his head and he can't get it up, you're causing that a lot of the time, seriously.
For sure.
And don't overthink it too.
And that's why I speak to a psychiatrist, speak to a sex therapist with your significant other.
It's here a lot of the time, especially when you're young.
For sure. Well, you said it perfectly. In younger patients, like the 30s, I would say the 40s, I would think most likely psychological, right? It becomes very physiological or organic as you get older, of course, just to secondary, issues, complications, diabetes, obesity, smoking, atherosclerosis, hypertension. So there's so many factors behind it. So yeah.
Get healthy, get an erection. Yep. That's how it is.
ED.
We got you at Doc Talk. We will take care of you. We help improve relationships.
Let us know.
One person at a time.
Let us know if you have any questions, guys. Leave it in the comment box, and we'll be more than happy to answer.
And if you haven't subscribed, guys, oh boy,
we know where you are.
Please subscribe to our YouTube channel. I see you guys. I know who's watching. Comment, like our videos. Show us some love, guys. We put so much effort into this. It's not easy doing it with a full-time job. Absolutely. And we're trying to help you guys get healthy and kind of keep you guys entertained through this, okay?
Exactly.
Help us out. We love you guys. Share with it. Share with all your family members this video, and I hope you guys like it.
Definitely, man. God bless you all. Thank you so much for joining us again tonight. MJ, we're back at it, brother.
Yes, let's go.
I'll see you soon. All right, man. Thanks.